Okay, class. In this video, we are going to continue the discussion on inspection. In this video, we are going to introduce some abnormal situations in the clinic that we can see, or you might have the chance to see. Some of them are common, some of them are not common. The information from this video, some of the information here is not important for acupuncture treatment or for our future practice. The reason is because many diseases that we are going to introduce in this video is the diseases that we will not use acupuncture to treat them. But why we introduce or we show you some images from here, that's because as a practitioner, as a full training doctor, you have to know these diseases. You need to know which normal, which abnormal. At least you will know that if you see some of the phenomenon that we have shown you here, you will know that if a patient presents with this, you need to refer them to other practitioners. So from this video, I'm going to introduce some of the phenomena, the clinical phenomena, and also I'm going to show you how we going to use the theories to understand these phenomena. But as I said, there's many of these diseases. They're either congenital, that's from genetic, or we don't treat with acupuncture. Okay, the first one, for the neck and nape, we're going to focus on the shape and the movement. So normally the neck and nape move freely and intentionally. The first one we're going to introduce is goiter. Goiter is the enlargement of thyroid gland. This, just before we go into details, there's some of the diseases here in this video. And some of the physical examination method you're going to learn in the diagnostics of general medicine in future. So we're not going to focus on there. From here, we only show you some images, and as well as how we understand in Chinese medicine theory. For the examination, how to find, apart from the physical observation that we can see directly, the other more detailed physical examination method you're going to learn in the diagnostics of general medicine. So the goiter is the enlargement of the thyroid gland. It's the normal thyroid. So this is normal. When they enlarge, you can see the patient's neck here. It's slightly bigger. It can be on both sides or one side. Especially for goiter, it is the both sides. If the patient, if you see one side of the thyroid enlarged, you also need to send the patient to have the examination, such as the ultrasounds, and refer them to the other practitioners. How we understand the goiter in acupuncture theories, that we think that's the caused by qi stagnation coupled with the phlegm. The reason why is the qi stagnation become bigger. Now you just need to imagine that the thyroid, you just imagine here is like a balloon. So it's still a balloon, and there's one entrance, one exit. So the qi can go in, can go out. That's from the meridian. So the line is not like this, but here just as an example. The qi and blood through the meridian goes to the thyroid and goes out of the thyroid. And now if something blocked there, that's the qi stagnation. If something blocked the acid and the qi still going in, so it's very similar the balloon being blowed. That's why it become enlarged. That's how we understand the qi stagnation and phlegm. What can stagnate the qi? This can be a phlegm. That's more common in the phlegm. And for the phlegm, you also can see from the tongue. In future, we're going to study the tongue diagnosis. You know what's the cause of this enlargement in individuals. So that's the goiters. Firstly, you can see the enlargements from the neck. Scapula in other parts of the world, sometimes it is not common to see, but in African countries, especially in the rural areas, sometimes you still can see the manifestation. You can see as in the image that the patient presents with the enlargement of the nodules around the neck. When the nodules go one by one like this, it looks like the necklace. That's why it is described in Chinese medicine the bean-like or beaded nodules. So that's how you can. That's how what's the manifestation of this problem. This is in Western medicine is the TB infection. In Chinese medicine, how we understand that's because we think it's the deficiency fire due to insufficiency of the lung and kidney. The reason why is deficiency fire. The firstly why it is a fire, that's because the patient can present with, such as here, this image. The patient can present with the redness on the skin. The redness, you still remember in the facial complexion when we talk about the colors. The redness is the heat, is the fire. So this patient must present with the fire, as with excessive fire or deficiency fire. Now you need to compare with the other symptoms. You need to combine with the other diagnostics, especially for scapula or in TB infections patient. It can be in the phlegm, in the lymphs. You will see that the patient, most of the patient, especially after long term, they will present with like losing weight. They are quite skinny. So this is insufficiency. Patient with very skinny, they don't have body fluids in the body. That's why we think it's the insufficiency. So this can happen in the lung TB infection or the lymph, such as this one, TB infection. So that's how we use the theory to explain the clinical manifestations. It also can be qi stagnation and blood-stasis. Why we can explain with qi stagnation? That's very similar to the goiter we just introduced. That's because the swollen stuff, the certain area of the body become bigger. It is very similar to the balloon. It is blown. That's because of the qi, the air inside, and the stagnation, because the air doesn't move around. That's why it become bigger. So that's the qi stagnation. And for the explanation, we're going to give you a very quick, or I'm just going to pick some of the explanation. You can read your textbooks and see and try to understand, try to use these theories to explain the phenomena. Deviated trachea, as you can see from this image, that's the patient you can see here. So the deviated trachea, it can be the other diseases. It can be the results of other diseases, such as the enlargement of thyroid is on one side, we're also going to push the trachea to one side. It also can be the other problems from the lung. So for this is deviated trachea, just phenomenon that we can see, but from this phenomenon, this manifestation, we need to think about what's the cause behind this. So this also can be such as the water retention in the chest, especially in one side of the chest, the tumor or cancers in the neck area or in the lung. This also can result in some of them also can result in pulling the muscles to one side. That also can result in deviated trachea. So this problem, especially for tumor or cancer, water retention, mostly in clinics, we don't really use acupuncture to, although from the theories that we can use acupuncture to treat, because no matter what kinds of cause for this deviated trachea, we can we can explain with the symptoms, with the theories. So which means the patient can have water retention in the lung, the patient may have tumor or cancer that's due to blastocysts or due to phlegm or qi stagnation, that we can explain well for this deviated trachea. But frankly speaking, for these problems, we don't really use acupuncture to treat. If the patient prefers, we can use herbal medicine, Chinese herbal medicine to help, but we don't really use acupuncture. So just be careful for this problem. The reason why we're showing you these images is because we want you to understand this is abnormal. In this case, if a patient presents with this, don't they ask, hey doctor, what do you think my thoughts? Okay, what do you think my trachea? Though if you don't know that's abnormal, you say that that's normal. That's unacceptable as a practitioner. That's why we show you some of the images here. But just keep in mind that some of the diseases we introduce in this video, we don't treat with acupuncture. The inspection of the neck and nape, we're going to focus on the abnormal skin, such as the previous few slides we have introduced. We're also going to focus on the movement of the neck, the movement in terms of the rotation, flexion, extension, and lateral flexion. So these are some data that's considered as normal degree. The second is the visible carotid pulse. The variable carotid pulse is rare to see. Normally we don't see, so we don't really see the pulse here. If the patient can show the artery is beating, then you need to think about what's the cause. Okay, in the next few slides, we're going to show you some of the abnormal manifestations. In order to understand the abnormal movements of the neck and the cause of the abnormal movements of the neck, we need to understand what is important for the normal movement. So the aspects or the contribution factors of normal movement of the neck will be the normal function of Zangfu organs, as well as the normal function of the meridian, as many meridian travel through the neck to the head. Right? So if a patient suffers from any problem that results in the meridian problem, such as the blockage, it will cause the abnormal movements. The next stiffness refers to the spasm or the stiffness in the neck. That's why it's rigidity. If a patient presents with the neck stiffness, with the aversion to cold or chills, fever, that can indicate that the patient is suffer from the external or exogenous pathogen of the coldness. And this coldness causes the impairment of Taiyang meridian. Why specifically the Taiyang meridian? When you go back to the meridian and collaterals that we introduced in the basic theory, you will see that the Taiyang meridian travels from the head through the neck to the back all the way down to the foot. So that's the main meridian goes at the back of the neck. And why it is the cold pathogen, a wind cold pathogen. In the notes, we didn't give you the wind. It's actually the wind cold pathogen. The reason why the wind there, that's because in the neck, also the top part of the body, also the coldness need to go to the top part of the body, also need the wind. When we use these explanations, you will see we actually based on the characteristics of the pathogens, the theories from the etiology that we have studied in the basic theory. If the patient presents with a stiffness neck, with fever, with coma or unconsciousness, with spasm or cramps, this is due to the fire, the pathogen of the fire or the pathogen of heat, especially when you go to the head. So we need to combine with the other symptoms, such as the strong fever, headache, unconsciousness, the heat. As you can see, some of the translation is exuberance, and in the basic theories, we translate as excess. As long as you understand, you can use either translation. The lung diseases, febrile diseases, and the last one we mentioned here, the stiffness, pain or discomfort after waking up in the morning, known as the stiff neck, caused by the inappropriate sleeping posture. This is actually a part of the sentence. The rest of the sentence we didn't write down here results in, no matter what the cause is. It can be from the wind cold, it can be from the heat, the cold, the wind cold, the fire, the heat, or the inappropriate sleeping posture, or they also others, etc. Other factors that result in the blockage of the meridian will result in the neck stiffness. That's why in the treatment, we're going to focus on how to unblock the meridian. We're going to focus on recover to relieve the coldness, relieve the fire heat or the heat. That's how we use acupuncture to treat for this problem, especially for the neck stiffness due to wind colds. Actually, often we can use acupuncture to help. The neck flaccidity. Neck flaccidity also means that the softness. The patient can present the softness in the neck, so that's why it described as the inability to raise the head because the neck is too soft. This is often seen in children, contributing factors including congenital kidney essence deficiency or weakness of spleen and stomach. So these problems, why the neck become very soft or flaccidity, that's because of the bones is not strong enough. The bones is from the kidney, congenital. Why the weakness of the spleen and stomach? That's the spleen and stomach, that's the source of the acquired qi and essence. So that's also how we're going to treat this kind of problem. Although we don't use acupuncture, or more commonly we will use herbal medicine if you don't have to use acupuncture. If you have no other choices, you can use acupuncture to help. But just in general, for this problem, acupuncture might not work as well as herbal medicine. Neck flaccidities in major chronic conditions coupled with the head drooping and sunken eyes, often critical sign indicating fading of essence qi. So that's the final phase of the life. Carotid artery pulse. As we said before, that's carotid artery pulse. In normal condition, we don't see. If you can see the pulse from the neck, that indicates abnormal situation. In Chinese medicine, we think that's the hyperactive fire yang due to yin deficiency. Hyperactive fire yang. What's the hyperactive fire yang here? Here again, we go back to the basic theories. The balance of yin and yang. Right? One's yin, one's yang. Hyperactive yin and yang. Hyperactive yang, which means the excess yang, but that's due to yin deficiency. So this is not the excess yang like this, but it's more like the relative excess. Compared with the yin, the yang is got extra yang. So that's hyperactive fire or hyperactive yang of the liver yang, especially hyperactive liver yang. The reason why we consider these symptoms as fire or as yang is because the carotid artery pulse normally we don't see, but now you can see. The reason why you can see the pulse is because the movement of the pulse, excess movements, they're not supposed to beat. That's obvious. They're not supposed to be like this. They're only supposed to be like this. Then from the skin, we don't see because it beats like this. Why you can see? That's because the excess beaten. The excess beaten, what can cause the excess beaten? That's yang qi. That's the fire. This is very similar. When you cook the water in your pot, warm water, you don't see the boiling water, but the boiling water, you can see the bubbles, it's jumping. That's from the heat. It's very similar artery. So that's how to understand these phenomena, these manifestations. Severe blood deficiency. This is the opposite side of the sheet, especially if the patient have lost the blood. And in this situation, the pulse, when we study the pulse diagnosis, there's one specific pulse feeding also can indicate the severe blood deficiency. We're going to explain why you will see here and why you have that kind of feeding. The jugular vein extension is another section, so this one also needs to be bold. So jugular vein extension is not under carotid artery pulse. This also can indicates the blood stasis in the heart or the qi stagnation of the lung, the kidney, the heart and kidney yang deficiency. So these are some of the examples of how we understand these clinical manifestations. Next one, we're going to introduce the inspection of the chest and ribs area. On this session, we're also going to just give you a very general introduction, because for these examinations, it is more focused on the physical examinations that you're going to learn in the general medicine diagnostics. Because in general, when you see the patient, the first one, the patient is very skinny, and the second one is the diameter that we described in the previous slides, from left and right, from anterior to posterior, the ratio. The third one, the chest protruding. The last one, the chest is second. So these are some of abnormal situation. These situations, especially for these two, most of them due to congenital problems or congenital deficiency. So there's something innate. So especially for kids, if we don't treat them in very initial stage, the patient will be like this in future. So that's also not part of the treatments acupuncture can help. For this one, it can be some medical conditions can cause. Mostly this kind of patient will present with asthma, difficult breathing, and the cause is due to the lung and the kidney deficiency, especially the lung qi deficiency, the kidney qi deficiency. The first picture, this one is much easier, as we have introduced previously. Where did we introduce this picture? That's from the facial complexion. This kind of patient, the face also succumb, the eyes, and also very skinny, right? So this can indicate the yin deficiency or qi and yin deficiency. Why the yin deficiency? That's because the yin is a material. The patient why skinny? Because they don't have muscle, they don't have enough body fluid. That's the yin. That reflects that the patient don't have enough yin in the body. In this table, there are some abnormal changes in the thoracic cage. On this, you can just have a look and have a general impressions in your mind. As long as in the clinic, when you see, you will find out that this is abnormal. The last session of this video, we're going to talk about the observation of the breast. The observation of the breast is as important as the other inspection of the other parts of the body, but sometimes this area is inconvenient, especially for male practitioner when seeing a female patient. But sometimes it is important. The reason is, for instance, if a patient comes to you with a chest pain for a few days and become worse, for instance, become worse for one day. So from this main complaints, we will see that the patient suffer from chest pain and aggravated for one day. This chief complaints, it's very easy to guide us, to lead us to the heart problem. And then we focus on the heart. We're going to treat the heart, but the patient tell you there's no improvement from your treatment. The reason why is sometimes this patient is the inflammation from the breast or the inflammation of the skin or some other conditions that we're going to study in the next video from the skin. The patient also can present with chest pain. That's the other conditions. And these conditions are very easy to be avoided. Only you ask the patient to take off the clothes and you perform proper physical examination. You can avoid these mistakes. So the observation of the breast, if the breast presents with redness, swollen, warm feeling, it can be the inflammation of the breast. This also happens, more commonly happens in ladies, especially in a period of breastfeeding. And how we understand this kind of symptoms, if a patient presents with swollen, warm, red breast, firstly, the color, the redness, the red color is the heat, right? That's the heat. The heat, where the heat come from? The liver meridian travels from this area. So it can be the heat from the liver. It also can be the heat from the stomach. It all depends on the other symptoms, such as from the lung. So that's how we see this kind of patient. The patient presents with inflammation of the breast. How we going to, if a patient says, I'm breastfeeding, and I don't want to use any medicine, I don't want to affect the milk for the baby. So what you can help, you use acupuncture, but how you use acupuncture to treat the inflammation. If you think about the inflammation, you will think that Dr. Who never told me how to treat inflammation with acupuncture. So when you see a patient, we need to know that this is the inflammation, but we also need to know what's the cause from acupuncture theories. The qi stagnation of the liver, the heat in the liver, the heat in the stomach. So for our treatments, we're going to use acupuncture to reduce the heat in the liver, to unblock, to activate the qi circulation, to reduce the heat in the stomach. That's how we use acupuncture to treat this kind of manifestation. And also there's another patient presents, another old lady presents with chest pain, and you never examine it. You're going to focus on because this lady was old in her 60s, 70s. So you think that in my lecture, Dr. Who have told me that the patient, especially for ladies above the age of 75, might present with chest pain, with the heart condition. So you focus on there, but you just never observe the breast. This lady got the cancer, the breast cancer, and breaking the skin. That's why she feel the chest pain. So that's why the physical examination is very important in our practice. So when we see patients, don't try not to be lazy of the physical examinations. It is important. And again, that we're going to focus, especially for sensitive area, such as the breast or the external genitalia. These areas need to be careful when performing the examination, especially to avoid disputes.